I want to briefly say something about Ubuntu. Ubuntu is usually where, like you said, I am because you are, or you
Yes.
are because I am. It's a community-based mindset all across entire African community. And also, you say something that also true and also contentious in the sense that you mentioned that sustainability is not necessarily about money. However, I will also challenge that because of the fact that we have to also look at the type of system. When I say system, I meant political system we currently have all across Africa. Africa is socially uh, traditionally socially informed society. We're communal, we're in tribe. This that's Ubuntu mindset. But if you everybody here realize that due to colonialism, we adopted a different mindset, capitalist mindset. Capitalist mindset also informed individualistic mindset. So the question for me is, how do we Africans in capitalist system, in individualistic mindset, try to work together to still keep the Ubuntu mindset? That's, I think, the conflict and the challenge Africa is facing because Africa so far cannot still find their footing in their own traditional mindset of how society works. And the way to also substantiate that is let's look at Cuba versus the United States. Let's look at Cuba political system and let's look at the United States political system. You know what I can find? I agree that money is not necessarily uh, what you need to sustain something. But if you start looking at it based on political system, you can start to understand that. You cannot understand that statement without looking at the political system. With Cuba, they were able, their annual GDP is $202 billion. In that annual GDP, the US GDP is 31 trillion. And you know what we spent in health out of that 31 trillion? We spent 18% of our GDP in health, which is about $5 trillion. However, in conversion note of that money we spend, we don't have better health care in terms of that conversion note compared to Cuba. Cuba life expectancy is higher than the US. They are right now, currently in 2025, 2026, similar, 79 years old. And if you look at the infant mortality in Cuba, they have better low infant mortality than the United States. So again, you can see that money is not necessarily the primary causal effect of health, quality health. However, you also have to we don't have to just say it that way without looking at the political system. So, Cuba political system encourages that Ubuntu mindset. It's not a capitalist system. So when you look at all entire Africa, major, if I think all African political system are capitalist and capitalist totally informed, not Ubuntu mindset, but individualistic mindset. So we need to figure it out and need to find out how do we actually do this because it's not just saying out, but trying to find out how we have to balance that with the current political system. And we can see that also inform all the corruption we see from one country to another country, all entirety of African government. They're all corrupt to the point. I'm not saying that You go to the West, they're not corrupt. They're as much as corrupt as Africans, but they still have a way to build a system within their capitalist system to be able to maintain certain things and fund certain things without any foreign aid. Well, you can say the foreign aid may be coming out as exploitation from African resources. That you can say because the evidence is there. But also, that's what I want us to be clear and pay attention to. Funding is important, but it has to be important and informed by the political system in question. Cuba is a very good example. And what bothers me about this is also um, if we allow every country to establish a political system that suits them without sanctions, without wars, without forcing any other country to align to the Western way of governance, within 10 years, within 20 years, we will actually be able to sit down and say, well, hey, you know what? Look at this system. It works for this country. Look at this system. It works for this country. If you also look at Scandinavian countries from Norway to Sweden, they're not capitalists. 100%. They're socialists and look at the quality of care, quality of health they enjoy in those countries. So I think I think 21st century is a century that Africa need to reevaluate their political system and see if it's meant for them. Is it working for us since 1960s? And if it's not working, maybe we should start developing more Ubuntu mindset and integrate it into our political system and let it be the new way to go for Africa. So I will leave it at this and turn it over to you, Rosemond, if you have anything to say in what I just commented on. And other than that, I will turn it to the guests or the audience that joined the podcast to share their comments and suggestions.
Thank you very much for that intervention. I like that. The fact that you are linking what is going on to governance, the kinds of governance we have. And definitely, you realize, for instance, that the allocations that we're talking about are correlated to the kind of governments we have. I'm glad you mentioned Cuba. Yeah, they have practices that we can all learn from. But it still points to the fact that our governments must be committed. Our governments must be committed to health. Our governments must prove that they need a healthy nation. And the monies that they are able to allocate to health tells the story. If they are not going to politicize health, then we will win. But if they continue looking at development, politicizing development, we will be losers forever. You talked about corruption, yes. And so we need to be very clear. Our government, I don't know the kind of advocacy we can play here as practitioners to make sure that our governments are sincere about about health and putting in all that it takes to make sure that the health of the people are safeguarded. It's a necessity. And so yeah, we have a lot to learn, and the best practices are there. We don't need to reinvent, actually, particularly with what works. And I want to believe that um, AU, for instance, has a catalog of what works. And so we don't need to reinvent. We go to it and look at it and see which one will suit us. We fund those with our own monies. All I'm asking for is that what concerns us, particularly with prevention, particularly with early detection of non-communicable diseases and so on. We should use our own monies. We should use our own resources. We should use our own talents and knowledge. And that will take us far. Okay. Thank you.
Yeah, I 100% agree. There's a lot of work to be done. And one good thing about there's no system that will ever be perfect. I always promote the idea of having reservation for your expectation in anything you do, but also try to improve your best. That's the only thing we can do. We can look at the system we have, always see what is working and what is not working. And this is part of growth and part of improvement. That's when,
Mm,
when we do program in public health, we have program where we look at overview of the program, and we have the department that we call program evaluators. The program
mm,
evaluators' work is to always look at all the key points of the program intervention and evaluate it based on approach for that intervention. Evaluate
mm,
it on the basis of efficiency of that intervention and approach. Evaluate
mm,
it based on effectiveness of that intervention. Evaluate it based on the program impact. The
mm.
test of the pudding is always in the eating. So in
Yeah.
terms of all this stuff said and done, it's about we have the system. How does it affect life expectancy? Since
Mm,
1960, how much have life expectancy improved in all entire African country? Like you just said, the life
mm,
expectancy of Nigeria is still, for example, now they say it's in 50s. I think the number is inaccurate. It's lower than that, right? So how do we even have a sustainable surveillance system to collect, all these life expectancies? Are all hospital reporting the death of people in terms of accident, in terms of people that are died in the hospital? How are we collecting this information? So then we come around and also measure program intervention based on sustainability, which is always the part any UN, CDC, World Health Organization always put that out there. But also we need to pay attention that when we do any intervention, let us not think that sustainability should be part of the downstream measures. No, that's a wrong approach. When we design anything, we should design sustainability from the onset. And the mistake most of us make is that we like try to look at sustainability as afterthought. And that's a big problem. We need to start looking into sustainability from the onset. We started a program, we named the program, we need to start tackling sustainability right away. What are the things we need to start talking about? We have to start talking about, okay, well, we need to start talking about the funding. We need to talk about funding stability. We need to talk about environmental support, meaning do we have a supportive internal or external climate for that program? We need to start talking about partnership and collaboration. Who are we supposed to be collaborating with? What expertise are in that area that will help us sustain this program? We need to talk about the organizational capacity. All this element is what I put in my publication in 2024, and I put it in the chat. Anybody can go and look at my paper published in July 2024. Then we talk about project or program evaluation, program adaptation, program adoption, communication, and finally, you need to start talking about strategic planning of anything we do from that onset. So let me go to the chat, or if anybody have a concern they want to voice out, they can come on camera. If you can, if you cannot, that's okay. But go ahead and make any suggestion or ask question to Professor Rosemond. Go ahead.
Teresa.
Hello, Teresa. Go ahead.
I'm so sorry I cannot be on camera. We have this big match today on No King's Day in America, or 50 states. So, and the reason why I even bring it up, it ties down to the political determinants of health, which I'm writing on. I've not finished it. Hopefully, I will share this on this forum, how a political system can influence health. And Dr. Rosemond, I think you've said it so eloquent. And if I take anything home, you emphasize and re-emphasize, de-emphasize, to say the least, on primary prevention. As a public health practitioner, I believe everything you have said. And also, you are also calling for action on mobilizing the practitioners to look forward in leveraging primary prevention in Africa. Yes, I agree with you. Every single thing, I've been listening all along, although I came in a few minutes late because of the event. I'm just letting you guys know. However, though, I am asking you, because I don't have anything to ask about your presentation, what is your own take in terms of bringing Africans together to form a consortium whereby we can sit like this that Omelu has put together, but beyond this platform, even if it's a summit, to come one day, I mean global summit. I'm so much of an outreach person. I'm more clinical originally, but I'm passionate about public health in every core. So how can we galvanize this kind of forum to create an agenda in order to create a global health summit focusing on Africa? I know they have little thing here and there. I've not attended because when I look at the topic and the agenda, it appears as though it's driven by the same political system, no matter
Yeah.
where you are. Because I don't have to take anything you said. I believe in primary prevention. Just yesterday, we were able to rescue a woman who was, I can't even say this enough, not to take everybody's time. She has been in labor for 4 days, and the doctor refused to operate on her until my cousin and I from US ordered the doctor to operate on her to save the life of the mom. So these are things that are primary in a sense. We'll talk about mortality. So I need your opinion on this, please, because I'm not taking anything you've said. I'm just agreeing with you with everything you've said, because that's my take. So it appears as if you and I were talking yesterday or 2 days ago, because I was hitting on primary prevention in the villages at the grassroots level. Thank you
Yes.
so much.
Thank you very much,
Thank you,
Teresa.
Teresa.
Thank you, Teresa. I think, yeah, we some of us can go home happy. I can leave here happy, but because we have like minds. That is where we should put our resources. That is primary prevention. That is what we should do. Our mothers die for very simple causes, preventable. So I can imagine how you felt. And we have this in dozens, in almost every African country. How are we going to ensure that they are not repeated? We have to stop these things in their tracks by looking at the opportunities we have for prevention at the primary level. That is where I think we can
Yeah, thank you so
capitalize.
much. And I believe that I usually say prevention is primary. That's my phrase, right? The prevention is primary. We need to go in. I see Matthias have his hand raised up, but let me read multiple things I'm seeing here in the comment before I go to Matthias. Multi-sectorial approach. This is from Keledi. Multi-sectorial approach to finance health in Africa and prioritizing primary prevention rather than acting at secondary and tertiary prevention grade deliberation. Then Matthias also says something here. We need to focus on we need to focus a lot on prevention. Basic things like community sanitation, hygiene, and disease prevention are very important. In the past, we had town council personnel that enforce community hygiene. We have left these in Ghana. So so filth in engulfing us and causing diseases. Matthias, I 100% agree. I was telling Professor Rosemond that in my village in Oka in Anambra State, Nigeria, we used to have a community square. Right now, you can't even see community square anymore in where I grew up in. That also shows a very deep degradation of the society, of the capitalist incorporated society in Africa, where the built environment is not reflecting any type of Ubuntu anymore. It's not reflecting community engagement anymore. It's all about building things without considering uh, other social factors that lead to chronic diseases or infectious disease. That's taking over. And we also used to have a water board. It's no longer in existence in that village. What happens now is if you build your house, you build your own borehole. If you build your house, you build your own borehole. Again, individualistic mindset has kicked in and overwhelmingly taken over the situation. And Margaret says, how does a nation manage health sustainability in a dear economic strait situation? That's amazing, amazing comment as well. You know, again, that's why I always say we have to look at our political system that's moving away from Ubuntu mindset into a capitalist system and individualistic system. And then we have to weigh them over the economic situation and see what we can do. Majority of the funding that comes to Africa in terms of health comes from outside, either loan or grants. We need to cut that umbilical cord that is not helping us and start funding our health resources, our health intervention using local funding. But we have to build a system for it. You know, it's not just talking about it, but there has to be a system, a template we need to use to do that. Then somebody says, yeah, prevention must start in every classroom. Are schools on board? Uh, their data available is their data available to which community is doing what. So these are all few comments and questions people are posing here. And then somebody said there's a lack of health literacy, education is critical, and so forth. I will turn it over to, I think, Matthias raised his hand. Go ahead, Matthias.
Thank you very much. Professor Rosemond, thanks for such a beautiful presentation. One of the things that you talked about is that we need to depoliticize health in Africa, and I think that is a very important point. I realize that in Africa, especially in my country, Ghana, even health is so much politicized that when a government is in place, whatever it's doing in the area of health, the opposition seem to downplay everything and also try to put pins in the spokes, even when it's a good thing. Can you give us some suggestions as to how to depoliticize health? I think that's my first question. The second thing is you also made an important point that we need to diversify funding in health. And this is important because when USAID, when President Trump, closed down USAID, we saw a significant effect on our health institutions. I was in a health facility in Ghana, and all their oxygen cylinders were labeled supplied by USAID. And I was wondering if USAID were not there, where were they going to get their oxygen cylinders from? So yes, it's very important that we diversify the sort of funding for health in Africa, and also we should look a lot internally about funding, and also drive home the fact that our government should allocate a certain fixed percentage of their GDP in supporting health. Just as you said, that our government needs to rule over healthy people, and so health should be prioritized to the extent that a very good amount of the GDP is spent on health. Thank you.
Great question.
Wow. Okay. Now, let's look at the first one where you talked about depoliticizing health. I think a critical move will be government having development plans. I think I came here knowing that most of the time the manifestos of governments in power carries the day. But things are done differently here in Botswana. We have development plans. It doesn't matter who is in power. It is the development plan that dictates. And a percentage for health is there. There's nothing you can do about it. So you will realize, for instance, that when I was comparing countries and those that have met the 15%, Botswana was one of them. So there's a national development plan, which is put together by experts. They look at, and it's data driven. And so you look at your health situation, you have a policy. What are you going to be doing with regard to communicable diseases, non-communicable diseases? What is the nature of your infrastructure? How many new hospitals? And so everything is integrated in this national development plan. And so it doesn't matter whether the opposition, it doesn't matter what the opposition does. It is the blueprint for development in the country. And so if the government of Ghana will do that, it will take them far, because it is the development plan that dictates, and it's the budget for the plan that is approved in parliament. So maybe that is an example. It's something that can be replicated. If you don't have a plan, then you plan to fail. So that is what I will recommend. In terms of diversification of funding, yes, we need to diversify. We're not going to be getting funding from taxes alone. There's a mix of funding strategies and approaches. So government will have to decide, what is our mix? What is it? How are we going to be able to reach the goals of our health? You've set goals for yourself. Where are we going to do that? How are we going to do that? Are we going to look at out of pocket? Are we getting from taxes? Are we getting from insurance and so on? So you mix them, and then it will be a mix that will respond to your need. And so we need to do that. A few countries have that, and Rwanda is a perfect example of that. So I think I used Rwanda to illustrate. Yes, the fixed percentage. I'm just trying to say that, irrespective of the Abuja 15%, governments must sit and decide, make a decision about the health of a nation. Yes, 15%, maybe even too much. If really we are looking at primary prevention, the money must come from government's own resources, whether external funding is there or not. Government must ensure that there is that percentage. The percentages can shift, but the decision to invest in primary health should not be compromised at all. I also agree to it. Well, it doesn't necessarily have to be fixed. I'm just trying to say that it has to be responsive. We must get money that responds to our need for primary prevention. Thank you.
Yeah, this is a great question. I think I agree with both of you guys. I agree with Professor that there should be a percentage coming allocated in all African countries from their GDP. For example, Cuba ranges from 10 to 12% from their GDP. US is 17.9, which is rounding up is 18%. All these African countries, you look at their GDP and get a valuable amount of percentage that goes in health, and not only goes in health allocated, and I'm sure they do, but also what is the problem is that I don't know how effective they are enforcing audit on all the funding they allocate for a particular project. I can tell you the audit is not really transparent, and that's where the corruption grows really rapidly in Africa. Whenever you hear that there's S amount of funding allocated for a project, and you look around it, sometimes it's overestimated in terms of the actual cost of that project. And another thing I agree that definitely the health should be a right, it should not be a political tool. But obviously, it's convenient for politicians to use it for a political tool because they use it to palliate to the emotion of people for vote during election. But then once they get in, they will not do anything. There was a comment I heard from the current president of the current president of Botswana, Duma Boko. He was making a statement among politicians in Botswana, and he was talking about a young man, a very, very brilliant man. He was saying about how the bureaucracy delays impact and effort. You are elected for 4 years. By the time you put your plan together and you're trying to implement anything, the bureaucracy will drag you the entire 4 years. and you look at yourself and you realize you haven't done anything. You're lucky to be elected the next 4 years. You have the opposition party, with bureaucracy dragging your feet to the point, entire 8 years, you looking back and you realize there's not much done. So that
Yeah.
bureaucracy delays a lot in political system in Africa. So you keep seeing people recycle in government and you look at their record, there's not much done, right? So that also need to change that behavior. They're politicizing everything. So by their political system, just to make sure you didn't do anything, so that in the
Yeah.
next round, their candidate will come out and then criticize you that you didn't do anything. Meanwhile, they did it intentionally to drag your feet. So it's something that we need to also know that the political people use it as a tool to drag us around. But all said and done, the will has to show objectively on what we need to do to improve our health systems across Africa. Health is very, very important. It's not something that should be politicized. It's something that we should all wake up, know that we all individually have right to a free healthcare, a safe environment, and better healthcare. Another thing that's also important is if you look around Africa, can we proudly say that Africa, whether from the university to individual industries, have a sound pharmaceutical companies? A good example, look at COVID-19. COVID-19 just happened 2019, 2020, 21, 22, 23. And I did a documentary on it as well. All entire Africa was standing in line, begging US and Europe for basic things they can do. PPE, mask. Everybody was lining up begging Africa. And it begs a question, why couldn't African country be able to make their own PPE and sustain it? That's one question. Second, why is it that Africa, up till now, cannot actually make their own vaccine? From all the vaccine that you can talk about, polio vaccine, we have the highest prevalence of malaria. Why is it African country cannot do their own research and make their own vaccine for malaria? But the vaccine that's approved right now for malaria is not made by African. Yet we have the highest prevalence of malaria. So those are the basic things we need to start asking ourselves. Why is it that we are not the one leading our own pharmaceutical company? But then if pandemic happens, we will stand in line. Just common test for COVID-19, we can't even make it. We have to import it from either US or other countries. We can't even make a common fit test or common COVID test, pregnancy that simply look like pregnancy test to use it to test for COVID. And then obviously the vaccine all came from either Pfizer or came from other biotech company from the US or China or other country to make it. So these are things we need to start thinking. It's not just talking about, okay, we have this idea and the system. Well, where is the pharmaceutical aspect of health? Can we actually be proudly say that we have the capacity and the will and the funding to produce anything in that level? We don't. And where is the risk? We should be working with a lot of universities across Africa to be able to start looking into new therapy. And then should be competing with developed countries. We should be competing with other countries in therapies, filing. There's an article I read a few weeks ago about, I think it's Russia and China also have now vaccine for cancer. Where are we in all this? Where is Africa in all this? and we are in the 21st century. So there's multifaceted things that we need to start looking. And I agree with Rosemond, the government has to be invested in this before we can make any change and before we can make impact in Africa. So I think a few podcasts, Rosemond said that Africa need specific African culturally tailored unique way to deal with health. And this is one of these topics where we need to start thinking about how do we do that? And what are the barriers for us to do that? How do we tackle those barriers in objective way? Not theoretical way, but in more objective way that we can evaluate and follow up and see if any change can be made. So I'll leave it at this for now. And if there's any other person that want to ask something, please do so. Otherwise, I will close this. But this is a very, very good discussion that we had today. I learned a lot from it, and I will post this video.
I have a question.
On
I have a question or a comment.
Okay.
Can I please ask or
Yes,
make my comment?
Go ahead, Pat.
Yeah, thank you for this session. I joined late because I got the link late. When you were talking, you talked about government involvement in terms of maybe funding and policy in terms of development plan. I think the Professor Margaret or Dr. Margaret gave example about Botswana, where they have a health policy, maybe action plan or development plan. So whenever each government comes, that's what they look up to. I was thinking about, because when we talk about public health, as you all know, public health is health promotion, disease prevention, and also improving quality of life. And in community health, the little I know is we start where the people are. And I'm a Ghanaian living in America. I was thinking in Ghana, what can we do at the community level? What can we do to mobilize people to take control over their health? As some of you will agree with me, Ghana, when it comes to funerals, the way we can mobilize funds and people to do funerals, we don't ask government for money for things like that. But when we go into our communities, in terms of the environment, they are not neat. Sanitation is a huge problem.
Yes.
So I'm thinking about, even at the community level, where the people themselves, what can we do to making sure that our neighborhoods, they have the district assemblies, there are those Ghanaians connected to this line. And what can we, the people themselves, what can we do? Somebody said education. Yes, it's very important. Because the little things that we can do, not looking at the politicians, but mobilizing people. We all grew up in villages where we used to have what they call the town council. If you don't weed around your neighborhood or clean your bathroom or something like that, they will summon you when we're kids. Because the sanitation problem is huge. So I'm thinking about, even at the community level, how we can mobilize people to take control over their environment and their health. So that's what is going through my mind as we were talking. Yes, the government is there. they have to come in, they have to make those policies, we have to get the funding, the pharmaceuticals, but the people themselves, what can we do in our small communities to making sure that the sanitation issues are, addressed at the community level? And that will go a very long way, to prevent. So that's my take. I don't know.
Thank you very much. Thank you very much, Pat. Um, yeah, you've raised very pertinent questions and giving us thoughts that we need to, I'll take home. If the town council era had been sustained in a way, I mean, the fact that things have fallen apart tells me that,
No,
yes,
actually,
those measures.
no, I was saying Chino Achebe things fall apart. Yeah, go ahead.
Yeah,
Yeah.
the center cannot hold. Yes,
Yes, definitely.
that yes, the town council concept was good for the time, but how were those interventions leveraged over the years? It's likely that they were funded from somewhere. And you see, one of our biggest issues is this with regard to funding. Even when we are taking the money from internal resources, we don't replenish. I am sure you understand where I'm going. We don't think about replenishing that source. And so it becomes unsustainable, because if I take the money and I don't replenish it, the money will be depleted. And so it got to a stage where much as town council activities were useful, we couldn't continue. And it means also that we were not able to impart. Most of the time, when we talk about health literacy, we are looking at, I normally use an acronym. O meaning I'm able to obtain information that is authentic, health information. P is when I'm able to process that information. U is when I understand and be able to use that information. Then I is when I'm able to impart. We should be able to impart. I mean, if we got literate health wise and we are not able to impart at the home level, I don't teach my children how to wash their hands when they come back from school, or they enter the house from outside, they've gone out and come in. I think COVID taught us all these things. But before then, we were not that conscious about washing of hands. Very simple washing of hands. So, Pat, I agree with you. There are very basic things that should happen at the home level, and they are not happening. Over the years, we close our eyes to them, and then they affect us. Our compounds are weedy. Should we be told to weed? No. Should we be summoned first? You ask yourself. Does it make sense? No. If you compare, sometimes you go to South Africa and you will be, I don't know, so disheartened. You look at the different communities. You look at the black community, you look at the white community, and there is a huge difference. And you wonder, what is going on? For how long are we going to blame uh, colonialists? For how long? Colonialism. For how long? For how long are we going to blame apartheid? You see, so there are certain things we can do for ourselves, and those ones we must do. And I'm saying that when government sits at the center and mobilizes and knows where to take their people health-wise, we will go very far. Yes, we will. So the entire system will be empowered up to the family level, household. I'm happy that we have community health practitioners around. That is what it takes. We have to start from there, from our homes. And if we have healthy homes, we'll have healthy communities, we'll have healthy nations. That is all it takes. And then we can avoid the secondary and tertiary that tend to be costly. Not avoid completely, because when you look at behavior change terms, maybe we can get up to 60-70% who will change. Maybe up to 80. Those 20 will still be problematic. But yes, we start from there. Primary prevention is the way to go. Have I have
This,
I
this
helped?
yeah, this is so
Yeah.
good because Prof, you know, we will never, again, that's why I used earlier say we should start having reservation for our expectation because if we expect that, take for Botswana, for example, that every 100% of the population has to be involved, that's delusional. It will never
Mm,
happen. We will
yeah.
never have 100%. But if we do have majority of the population to understand what health is, that's good
Mhm.
enough for us to lay the foundation of everything we're talking about. You never, even in any type of study, you will never get 100% accuracy of any drug that this drug cure cancer and 100% of the time it cures cancer. That's not scientific. You will always have the, tail end of outliers of everything. So we now in Africa in 21st century has the highest number of people who are educated in Africa. If you come here in the United States, majority of the doctors, public health as expert that makes this country run are from Africa. So
Mm,
we have the resources, we have the expertise, and the question that Pat is asking is a very honorable and very valid question. How do we do
mm,
this? How do we, uh, you know, engage in communities? Like I said earlier, Africa, any African country you go to has the Ubuntu mindset. What
mm,
happened to that? What has happened to the Ubuntu mindset? Again, it comes back to the individualistic mindset. And then the question will be, how do we go back to this? Because we know this works. We have to engage community where they are. And now a lot of CDC work is about social determinants of health. Social determinants of health. What is it? It's about looking at progress in health, healthcare, sustainability, life expectancy based on social environment, built-in social environment, engagement of the community. Cuba has been a good example. I don't know, many of you guys hear the term called promotores. Cubans have people from the community that are known by their community members are the one doing social work, are the one doing community health work. They go
mm,
door to door. And when people start seeing the outcomes of a reaction to a particular cases or incident or disease or something, they start seeing the evidence and the evidence is shared among the community member, they get motivated and say, you know what, this works. So we're going to put more time to make sure we sustain it. So that's the mindset we need to follow in Africa. Are we able in any African country to have a surveillance system where as we move forward to provide intervention in community, do we also be able to transparently share those information so the community members we're engaging can be able to readily see, you know what, this works, right? Instead of them thinking, yeah, I donated money in here. I donated money in this community because I'm part of the community. But every single time I donate money, there's this house burglarized if it's security. If people are living a community, community and they're putting money for security, but every single week each household is reporting being burglarized, you're not going to be incentivized to continue putting money in a system whereby you're putting money for prevention of certain things and that thing continue happening. You demoralize. Nobody's going to continue, putting money in that. So that's what transparency also means in this. We should all be transparent. We are the change we are seeking. Each individual person that is in this podcast or outside of this podcast are the people that's going to change what we're talking about. It's not going to come from spirit. It's not going to come from a supernatural being. It has to come from us. And the reason I'm saying that there's evidence when you look at the US, when you look at UK, when you look at Norway, when you look at Canada, when you look at Cuba, this is done by people. It's not done by a particular supernatural being. So we need to start, reinforcing those ideas to all each other, one another in Africa, that change will come through us. It can never come from nowhere. It can never come from outside. And that's how we can walk through this. Somebody also here, Margaret, mentioned Africa has traditional medicines for local illnesses. Why can't we formalize this medicine, e.g., use of neem for malaria? This is a great question, and I've been saying this. This is a good example. If you look at the plethora of African medicine through herbal medicine, what surprises me is that the Ministry of Health in each African country are not even interested in creating a library. You can talk to local healers, get all the information of the leaves or herbs that they use, create a library. We are in the 21st century. I used to do cloning in a lab. I would clone a gene from bacteria, put it into E. coli, and then culture it and take out, run a lot of gel analysis and stuff, take out the gene I cloned from bacteria and I put in E. coli, and then I transfer that particular gene into agrobacteria. And then I use that agrobacteria to infect a plant, like, for example, corn or rice or tobacco or whatever, and then transfer that particular gene from bacteria or virus into a plant. And now the plant will have that. So we have the technology now that we can look at all the library of our traditional healers and do a clinical trial for it. We will find the active ingredient, because every herb you talk about have a particular active ingredient that is associated with that effectiveness of that therapy. We have a plethora of African traditional medicine all across Africa. We should have invested in that. We should have created a library. Go from Nigeria, create a library for all this. Yes, there might not be all of them that works, but we create a library. Start using the universities across all Nigeria, for example, to test and look for the active ingredient in that medicine and test it for preclinical trial, test it for clinical trial. Majority of over 80% of drug done by U.S. pharmaceutical companies that were approved by FDA. 80% of those clinical trial, guess what? It's not done in the U.S. It's done in Africa, Asia, Why are they doing that? Because it costs $2 billion to go from lab to preclinical trial to clinical trial to get one drug that they will call a drug for a particular disease to come out in the market. So what they do now is do all their, I think they also do preclinical trial now in developing countries. Why? Because it's cheaper to do it in those countries. Then they do that, they're saving about 80 to 85% cost of those preclinical and clinical trial if they do it in developed country and the US. And then they come back and then sell that drug again to us in the same rate as though they did it in the United States. So what am I saying? I'm saying that we need to start investing in what we have, start looking at the library of this traditional medicine and see what works. We have a lot of stuff in Africa, but where is the interest? We are all educated. We know this. Most of the Ministry of Health commissioners are, most of them are educated even in abroad. So why they take this position? Why is it that they are not doing this? This is a great question from Margaret, and I always say that I've communicated the same mindset and the same sentiment to a lot of people. We have a lot of stuff that we can use and create libraries and start looking into it, and we will start developing drugs just like every other countries. So that's great. Thank you so much, everyone. This I wasn't expecting this to go into 2 hour session, but because the discussion is really, really engaging and very, very
Yeah.
interesting, as you can see, we are now in the second hour of the podcast. Rosemond and anyone else, do you have any other thing you need to say before I close this out?
I'm just impressed with the participation, and I'd like to encourage them to be with us. We will share with them and others our next postcard. And so, thank you very much. Thanks for the great questions. And we are learning a lot. And from here, what each and everyone can do, let's do it. And then we should even be able to review and evaluate the impact of these podcasts. Yeah. Thank you, Dr. Melo.
I agree. Thank you so much for accepting this invite. And I think I will invite you more and more into this podcast because you are super experienced. And if anyone that in this podcast want to present something, please, I will put my email address in the chat. Please send me email and send me the topic that you want to present, so I can invite you to present the topic. I just put my email in there. So if you're interested in presenting some topic, just send me an email. And please, if you go in the beginning, I put my YouTube channel in the chat. Please, if you have not subscribed, please click right now on the YouTube channel. Please click subscribe. And if you want, please copy that YouTube channel, share with your network, and suggest to them to subscribe. The subscription, again, like I said, is free. This is the only way you can support, like we are talking about, what can we do to move forward in this. The more people see this podcast, the more we can get something done, because we have a lot of information presented in this podcast. And when I share the podcast in the YouTube channel, if you already subscribe, you will get an alert to see the podcast. And also, when you do get it, please also share with your network and friends so that we can share this particular podcast around so a lot of people will see them. Please, again, I will be more appreciative if people subscribe to the YouTube channel and continue to support us. Thank you so much, everyone. I really thank you because there's a huge turnout in today's podcast. So I really appreciate everyone that provided any suggestion, comment, and also those that attended and spent their time listening to what we have to say. I really appreciate that. Thank you and have a wonderful week.